Hi everybody, this is Joel Wood, your lobbyist here at the Council. It's a really busy week, very excited, getting geared up for our annual legislative summit next week with all of the senior executives for many of our member firms that are coming into town to walk the hallways of Congress on broker-related issues. I'm really excited about the program we have. Among other Capitol Hill luminaries and political figures, we've got Paul Ryan, the chairman of the House Budget Committee, one of the most compelling political figures in America, who's confirmed that he will speak to us. Chairman Spencer Backus of Alabama, the chairman of the House Financial Services Committee, and Senator Ben Nelson, who's going to be retiring this year but is a leading conservative Democrat. On the Ben Nelson front, he and Senator Mary Landrieu of Louisiana announced last week that they plan in the coming days to introduce legislation that would scale back the broker issues associated with the minimum medical loss ratio that would exempt agent broker compensation in small groups from the MLR calculation. Now, this is somewhat different than the legislation that has been introduced on the House side on a bipartisan basis that we've got 160 co-sponsors for, the Rogers-Barrow legislation, which would completely exclude agent broker compensation from the MLR calculation. This would be limited to small groups and individual plans on the Senate side. But we are very, very pleased that they're introducing this. We had frankly hit a brick wall when it came to trying to get Senate Democrats to take on this issue, so this is a great breakthrough. We'll be working to try to enact this legislation. For us, it is a matter of the MLR being a governmental cost control that we are philosophically opposed to, and across all plans, the compensation pinch has been dramatic as a result of the enactment of the MLR and the Affordable Care Act, not just those in small groups and individual plans. And this is being cast somewhat as a small agent jobs-related issue, where we would really prefer to cast it from the standpoint of what's in the best interest of insurance consumers. But again, we support the legislation. It's one among several that we're going to be pushing for the enactment of, also fighting for regulatory reform, regulatory relief. Finally, on the healthcare subject, for the first time we heard Mitt Romney last week in Florida utter some words about consumer-driven healthcare that I found to be somewhat troubling. Especially with the Florida primary coming up on Tuesday. He talked in answer to a question about what's wrong with the health insurance system today. He said that what's wrong is that the tax breaks go to the employer, not to the individual. And this is not unlike a lot of other Republicans in terms of their espousal of the pure philosophical consumer-driven healthcare idea. I get that philosophically, I understand that, but I think if you've got 50 million uninsured Americans today, just imagine blowing up the employer-provided group health insurance marketplace and letting everybody fend for themselves. So it's going to be an interesting aspect of the ongoing debate this year, and I look forward to being able to update you, and I look forward to a great legislative conference next week. Thanks to all who are participating.